Good afternoon. I'm Pat Living with the Department of Health and Social Services, and I'll be your moderator for the COVID-19 update for Tuesday, April 28th. We are joined today by Yukon Premier Sandy Silver and the Yukon's Chief Medical Officer of Health, Dr. Brendan Hanley. Following their statements, we will go to the reporters online for questions, and following our regular process, one question per reporter with one follow-up. If we have time, we will entertain a few questions after. Thank you. Premier Silver?
Thanks, Pat. Good afternoon, and thank you everybody for joining us today. I would like to begin by acknowledging the day of mourning. We take time today to reflect on the lives lost due to workplace incidents, accidents, and those who suffer a work-related illness as well. This year more than ever, our country is grieving. The recent deaths in Nova Scotia have impacted us all. One very notable death was of Constable Heidi Stevenson, who died on the job protecting Canadians. Everyone should feel safe at work. Earlier today, I was honored to make a pledge on behalf of our government to keep workplace safe today and every day for all Yukoners. It has been several weeks since COVID-19 pandemic changed how we live our lives here in the Territory. As the days and weeks go by, people are wondering when things will return to normal. I can appreciate the yearning to get out of our houses, to socialize with friends, enjoy a meal at a restaurant, and get a haircut, which I desperately need. The frustrating part is through all of this is that determining an end to the current restrictions, well, that's not very simple. It's very complicated. It can't be based on any one thing alone, and it will take time and considerable planning as well. As of today, we have 11 confirmed COVID-19 cases in the Territory. Our numbers remain low, and that is an extremely good thing. What it means is that the measures that we have been taking to address this spread of the virus in Yukon, they're working. These measures have been disruptive and challenging for all of us, from home to work life, business operations, socializing, and everything in between. Everyone is impacted by this situation, and it has absolutely not been easy. I want to thank the healthcare professionals working across the Territory to keep our communities safe and healthy. I also want to thank the many frontline workers who continue to show up day after day so that Yukoners can get the food, medicine, and supplies that they need to manage during this pandemic. Our Territory would not be able to function without you. And staying home is simply not an option for you, so thank you. I would like to make note of the great people who work and do great work with the medical laboratory work in Yukon. This week is National Medical Laboratory Week, and I would like to celebrate the contributions of Yukon's dedicated medical laboratory professionals. These people, these professionals, they work tirelessly, not just during the pandemic. They work tirelessly to provide a life-saving service by giving timely, reliable medical test results to help diagnose and to treat Yukoners. I encourage all Yukoners to join me in thanking medical laboratory professionals for their expertise and dedication as a core member of our healthcare team. I would also like to thank all Yukoners for pulling together, supporting one another, and being patient as we work through this situation. As I said, everyone is impacted by this pandemic. The government of Yukon is here to help Yukoners through these challenging times. We are supporting Yukon families, businesses, and workers to keep our communities strong, and we will continue to do so. Thousands of public service representatives, workers, they are working tirelessly to rapidly adjust programs and services to address the ever-evolving situation that we find ourselves in. The Yukon government is one large and diverse organization. And COVID-19 has prompted a significant shift towards a highly adaptive, nimble, and responsive approach to public service. So I want to thank all of the staff for their efforts to continue providing Yukoners the supports that they need. The collective effort in the territory to minimize the spread of COVID-19 and to mitigate the social and economic impacts continues to be inspiring. Now, the reason for all of these thank yous, again here today, it is absolutely vital that these efforts are not wasted. When it comes to easing restrictions and reopening the economy, we must take a precautionary approach and act with an abundance of caution. Our priority as a government is to ensure that we use public health as a foundation for our decisions, to ensure a successful reemergence and restart of society and the economy when the time is right. If we move too quickly or without understanding the necessary planning and coordination, we risk increasing the spread of COVID-19 in our territory. That would force us to reintroduce restrictions that would further disrupt society and economic conditions in our territory. And nobody wants to see that. At this time, we are undertaking the necessary planning and working with the rest of Canada in charting the pathway forward. I have been speaking regularly with my fellow premiers across the country to ensure that we are all working together in a coordinated manner as we look at easing restrictions. Today, Canada's First Ministers released a shared statement on the guiding principles that we see as central to safely restarting society and the economy. The approach outlines the conditions needed to begin moving towards a gradual and phased approach to lifting restrictions and getting our communities moving once again. At the heart of our approach is the need to continue protecting the health of Yukoners and all Canadians. The easing of restrictions will be gradual and will be done in a way that protects high-risk members of our communities. Yesterday, Minister Frost announced that we have received additional ventilators for the Public Health Agency of Canada, significantly increasing our territory's capacity to provide acute care in response to COVID-19. But as Dr. Hanley and I discussed earlier, we don't want to have to use these ventilators. While we have not had any cases of COVID-19 requiring hospitalization, it is essential to ensure our public health system remains well prepared to address the pandemic going forward. We remain committed to a science and evidence-based approach while keeping in close alignment with the rest of Canada to the degree that it makes sense. It is important to note that each jurisdiction is in a unique position when it comes to COVID-19. Because the virus knows no borders, the actions of one jurisdiction can easily impact a neighboring one. I can share with you that all premiers understand how important it is to consider the economic impacts related to our enforcement approach and the decisions around when we lift restrictions. In Yukon, my cabinet and I will evaluate all decisions on how and when restrictions are lifted by considering the advice of Dr. Hanley and that of our colleagues across the country. We cannot pretend we operate in a silo in Yukon, but we do know that our northern situation is different than our southern counterparts. As we determine what our territory's path for reopening looks like, we know that we are focused intently on how best to protect the health of Yukoners, how to protect our most vulnerable citizens, and how to support our economy. To best inform our decisions, we will continue to work with the Office of the Chief Medical Officer of Health, Yukon's business community, Yukon First Nations chiefs and community leaders, and our national counterparts. As plans are developed, we will keep Yukoners informed. Again, I appreciate that these are highly trying times. We want to return to life as it was, or begin again, but in a way that's even better. But it's not time yet. We must continue to be patient. We must remain diligent in the fight against this virus. I know some provinces have released early plans for reopening and lifting restrictions, plans being the big word there. It is important to keep in mind that in several provinces, safety measures were more restrictive, far more restrictive than they were in the Yukon or in what Yukon has placed so far. Their responses were, in many cases, much more severe. Because of this, they are now able to lift restrictions that we have not yet put in place and hope not to have to. For example, in Yukon, we have ordered bars and personal service establishments like hair salons and massage therapists to close. We have also prohibited dining in restaurants, though they still can provide takeout services as well as non-emergency dental care. Now, we recognize how challenging this is for business owners who have been mandated to close and feel paralyzed during this crisis. Please know that we will consider your unique challenges as we plan and move ahead. Those businesses not mandated to close are making the decisions to open or to close based upon what they feel is the safest, most responsible approach for their staff and their customers. Some have closed completely. Others are finding new ways of doing business, such as online ordering and curbside pickup and takeout options. Unless a business has been ordered to close, the business owners is free to make a choice on whether to continue operating. I encourage Yukoners to support local businesses. If you are able to take this opportunity to order dinner from one of the great local restaurants, for example, shop locally for goods instead of buying online, please. Or browsing a local business owner's online store from the comfort of your own home. Whatever support you can give is appreciated right now more than ever. These businesses have worked really well with inside the guidelines and the mandatory restrictions to be able to offer services for Yukoners, and we really appreciate that. I want to close by thanking Yukoners for all of the sacrifices that they are making. I know that I'm not alone in hearing stories of great online gatherings or physical distancing, social interactions. I'm also so impressed with people's creativity and resilience, but I also recognize that this is not a replacement for the real thing. A hug from a friend, a shared birthday cake, a play date with little ones, friends and family. We all miss those moments. They're extremely important in our growth as people. But thank you. Thank you for keeping your distance, for washing your hands, for avoiding large gatherings, and for staying home when you're unwell. Thank you for adjusting your approach to work so that you can take care of your kids and still manage your projects. Thank you for rocking the floppy hairdos while you resist getting a home haircut. I appreciate all that you're doing, Yukoners. I really do. And I look forward to the day when we can continue and our normal lives or re-enter into what normal life should be. Thank you very much. And pass it off to you, Dr. Hanley.
Thank you, Premier. Good afternoon, and I hope everyone is doing well. And I want to echo the Premier's thanks to all of Yukoners for doing what you are doing to participate in the COVID response. Even though we only have had 11 confirmed cases to date in Yukon, it seems we've already been through several phases. It's all the more remarkable then that our official stage in the pandemic has not changed in 5 weeks. We have cases, but all cases are contained and all are related to importation from outside Yukon. We've been through the anxious time of preparation as we saw COVID's inevitable journey towards Canada. We watched through the first few cases in Canada, then the first signals of community spread in the provinces. We experienced together the first cases of COVID in Yukon, the first cluster and the second. Meanwhile, we crunched through the layers of advice and recommendations and the rapidly assembled orders to restrict borders and put in place all the necessary public health measures. We declared a public health emergency even before our first case, followed by invoking the Civil Emergency Measures Act. And now, like the rest of Canada, we are contemplating reopening and what that should look like in Yukon. So I want to start by reassuring you that we have been very actively working to support the government of Yukon in its planning to reopen. The decisions for reopening will be made by Yukon government and the Premier based on a public health framework and the advice coming from my office and the large team that supports my work. In turn, this public health framework is a product of intensive and frequent meetings with my counterparts and staff in all other jurisdictions, as well as the Chief Public Health Officer and the Public Health Agency of Canada. Our work right now is not so much about the details of a plan, but about what are the right principles to inform a plan so that it is safe, reliable, and has the trust of all Yukoners. We cannot wait too long, as we know there are significant, if not severe, financial, social, and health-related impacts to the current restrictions. But we certainly cannot go too fast and risk undoing the careful work that we have all participated in to date to minimize COVID's impact in Yukon. Let it be clear that if we relax too soon or too much, we could, in the blink of an eye, be overwhelmed by a local COVID outbreak or epidemic. At the same time, it's worth reminding ourselves of the following. We're still in a good place with high testing rates since we first had a test, and with confirmed cases limited to single cases or family clusters. We also, like the Premier said, have less restrictions in place than many other areas. So we can therefore concentrate on what we can do now while we work through the details of what reopening Yukon can look like. On March 22nd, I announced several public health measures to reduce the risk of transmission within our communities. This included closing the bars, transitioning restaurants to takeout or delivery only, closing personal services establishments, also prohibiting all but emergency dental services. In addition, I advised Yukoners to start practicing physical distancing, increased hand hygiene, staying home when sick, reducing non-essential travel to communities, and banning gatherings of more than 10 people. As a result of these measures, I know that some businesses, for a variety of reasons, decided to temporarily close or reduce operations. If your business is not required to be closed under the Civil Emergency Measures Act, in view of where we are today, you may, like the Premier says, wish to consider whether now is the time to reopen your business with appropriate risk mitigations in place. I know there have been some different interpretations about how the ban on mass gatherings applies to workplaces. Business premises or workplaces are not social gathering places. What is important for businesses to consider is how many customers and employees can be in an establishment at any one time while still supporting physical distancing of at least 2 meters apart. Other measures that should be in place include frequent hand hygiene for both employees and customers, ensuring people who are sick are staying away. My office is working on guidance to support businesses on how to safely provide services to their customers while protecting employees. General guidance for businesses is available on yukon.ca, and we're working to create some industry-specific guidelines to further support more specific needs. It's important to state that for many businesses, the public health risk is adequately minimized as long as physical distancing and hand hygiene practices are followed. For those businesses where there are increased risks identified through the public health orders, I commit to working with you to determine how you can safely provide services and allow Government of Yukon to transition towards lifting the current orders over time. I want to take a few minutes to discuss social connections, because I know many of us are struggling with the loss of the important connections in our life, with the families, friends, communities, and colleagues that we have. And while it's likely that physical distancing will continue to be part of this new Canadian normal, there are opportunities to connect and spend time with those who are important to us while still observing these public health measures. On April 2nd, the order released through the Civil Emergency Measures Act stated, "Not more than 10 persons may congregate in the same place, except when they are congregating in the place where they all reside." The legal interpretation of my previous order has caused some confusion, so I want to take this opportunity to provide clarity. The ban of gatherings again of more than 10 people refers to social gatherings. This means that any outdoor gatherings should be with 10 people or fewer, as long as individuals are appropriately spaced and follow appropriate hand hygiene. The current gatherings on people over 10 does not apply to retail or commercial or workplace operations. So how does that play out in practical life? In general, it means when inside, stick to your household bubble. People that gather indoors should be limited to usual household members and or close family members and should not exceed 10. In your workplace or for other organized gatherings such as worship services, observe vigilant physical spacing and limit the number of people, staff, customers, or clients in order to respect the physical spacing measures. It's important to remember that the maximum number of people per workspace depends on the size of the establishment and not the absolute number. However, people within a workspace must space appropriately and take all the precautions around hygiene. The reason for this is that people can transmit COVID-19 through respiratory droplets that can be passed from person to person or onto surfaces, often as a result of that happening through the close, prolonged personal contact that occurs within an indoor space. When outside, the risk of transmission appears to be much lower. In these settings, adequately spaced gatherings of 10 can be tolerated. An example I talked about recently was gathering around a bonfire. Many of us enjoy spending time around a campfire. So for outdoor gatherings of friends, it's a great way to get together while observing correct spacing. In the spirit of protecting each other and care, I want to point out today is the second day of National Immunization Awareness Week. The importance of this week cannot be overstated, as it's a reminder to us that vaccinations support our collective defense against disease. Routine immunizations are highly effective in controlling infectious diseases. However, delays or cancelled routine immunizations due to events like COVID could potentially lead to outbreaks from vaccine-preventable diseases, and we have had those outbreaks before. To stay protected as a community, we need to take care as much as possible for all our health needs, including what we need to do to stay in good health. Make sure that your children or yourselves are up to date with immunizations. If you're not sure, talk with your health center, with the public health nurses at Whitehorse Health Center, or with your family doctor. As you know, we introduced new, broader testing criteria for the Yukon last Friday. We've always enjoyed a high testing capacity in Yukon, and we wish to maintain high testing rates. We've been planning this change for the last few weeks as we anticipated the end of influenza season and the need to stay in a good position as we plan together the framework for easing restrictions. One of the fundamental requirements is a high testing capacity. So, as reviewed last week, our new approach will now capture all individuals with symptoms of fever or cough or difficulty breathing, regardless of travel history outside of Yukon, and an expanded list of symptoms for individuals who have traveled out of territory. Testing persons without a history of travel is another way of ensuring that we're staying ahead of detecting community spread. The fundamental conditions of staying safe as we advance the conversation of opening up Yukon is the so-called Safe Six. The 6 steps to staying safe include the basic principles as we've reiterated so many times. physical distancing, staying at least 2 meters apart from each other, regularly washing hands, staying home when sick, avoiding those gatherings of groups of 10 or more, reducing travel to the communities, and self-isolating when required. These Safe 6 principles, when combined with the 6 Canadian principles for relaxing measures, are what will set us up for success in planning for the next steps. To reiterate the 6 Canadian principles, they are, number 1, that COVID-19 transmission is controlled to a level of sporadic cases and clusters of cases. In other words, the state that we're in now. Number 2, sufficient health system and public health capacities are in place. Number 3, outbreak risks in high vulnerability settings, such as continuing care, are minimized. Number 4, workplace preventive measures are established. Number 5, the risk of imported cases is managed through border measures. And number 6, that communities and stakeholders are fully engaged in the process. So these are the fundamentals. Over the next few weeks, both the Premier and I will be talking in more depth about how we can all align and plan a healthy and safe approach to opening up Yukon. Thank you.
Thank you, Premier Silver. Thank you, Dr. Hanley. We'll go to the phone lines now. Gabrielle, Whitehorse Star.
Hi. In regards to some businesses choosing to reopen, I'm hearing some confusion about gyms and fitness centers reopening. Can you clarify that fitness centers are not a personal service and why that is?
Yes, I can speak to that, Gabrielle. So, yes, like some other jurisdictions, and the approach has been different, again, in different jurisdictions, according to their interpretation, their public health acts, and their stages in the pandemic. But we have not closed fitness centers or gyms or ordered them closed. And some have chosen to close according to individual criteria. That might be their capacity to maintain reasonable status while observing the physical spacing measures that would be required. So it does not fall under the Personal Care Services Act. These are fitness centers. Now, in the case of certain ones like Better Bodies, which is probably the one that has had the most attention, they closed to readjust their measures and reopened, and we have been, through environmental health, we've been working closely with them to ensure that all the requirements are being followed as far as environmental health regulations, including cleaning and adequate spacing. So that again gets down to a matter of whether individual businesses feel that they can comply with requirements. If they have questions, they can bring them forward, and similarly, we can we can have them in touch with environmental health to ensure that if they have closed and choose to reopen, they can meet the necessary conditions.
Follow up, Gabrielle?
Thank you. Regarding your recommendation that people can still go outside and gather around a campfire, does that mean that you'll be making a recommendation that campgrounds open in the near future?
So that's a different issue about campgrounds, and it is one that I am working with the Yukon government to look at in more detail. Again, it comes back to what would be the requirements to enable safe reopening. So more on that to come.
And I'll add to that too that usually campgrounds open mid-May. So our government to date has delayed that opening by 2 weeks until the start of June. So campgrounds, again, are inherently a place where people gather, as you mentioned, Gabriel. They bring people from different communities together in those shared places, including outhouses and cook shacks as common areas that are being used. And they don't have running water or systems in place for proper sanitation either. So we're currently working through several different considerations for what campground operations are going to look like in the summer, taking into consideration the need for maintaining that physical distancing and proper cleaning and proper sanitation as well. So we'll share information as we get further into that into the summer. Yeah.
We'll go next to Gord, Yukon News.
Yes. Have you seen an increase in testing yet, or do you predict to see an increase?
You know, it's only been 3 days, so yes, we have had a spike in testing over the weekend, and that was based on the provider guidelines that were updated and distributed to the healthcare providers on Friday afternoon, evening. So yes, there has been a spike, but too hard to bring sort of, you know, whether this is a temporary spike, how this will play out. I do expect we will see increased testing. I think we have a little bit of a spike that I would suspect may not continue from day to day, but of course we'll bring you that data as we get a few more days under our belts to give a bit more of a proper analysis too.
Follow-up question, Gord?
I don't have any more questions. Thank you.
Thank you. Chris, CBC?
Oh, hi. It's a question for the Premier. Premier, your government obviously has had to issue a lot of orders in council during the course of this crisis. You've had to commit to spending over and above what was included in the budget as a result of this. I guess I'm just curious what steps your government is taking to ensure that with the Legislative Assembly not in session currently, that opposition MLAs are going to have an opportunity to scrutinize the various decisions your government has made over the past month or so.
Thanks for the question, Chris. So, you know, no provincial legislatures are meeting right now. Our government is absolutely focused on how to manage through a national health crisis, unlike anything that we've ever seen before, and so we're focusing in on those daily tasks of working through crisis management. Our entire caucus is focused in on the needs of their constituents and of Yukoners, and I'm extremely proud of the work that they're doing as well. We did work with opposition parties to pass a budget in March and to adjourn the Legislative Assembly to allow us to focus on addressing COVID-19. Both opposition parties agreed to this, but we also committed to creating an opportunity for future scrutiny of the budget that we passed, and we are committing to that. But as that being said, you know, right now our team is extremely focused on the immediate work that is needed, and I don't intend on changing that focus right now. But again, we did make a commitment to the opposition.